24 million people in the United States have diabetes. It is a serious and potentially deadly disease, but it can be controlled. Dr. Scott Isaacs of the American Diabetes Association shows you some of the myths of the disease versus the facts.
Diabetes is a problem where blood sugars are elevated, and it typically takes years to really have an onset. And in the beginning, blood sugars are mildly elevated and it may not be detected, but with time, when sugars are higher and higher, that's when you have diabetes. The term borderline diabetes is not a used medical term. The term that we like to use now is pre-diabetes. And the truth is, with blood sugar, it's a continuous spectrum. And so it's not like one day you're diabetic and one day you're not diabetic. Being overweight or obese is a risk factor for diabetes, but not everyone who's overweight develops diabetes. On the other hand, there are some people who are lean who also develop diabetes. People always associate sugar with diabetes because the problem is elevated blood sugars. It doesn't just have to be sugar, but eating too much of any type of food can eventually lead to weight gain, overweight, obesity, and then diabetes. It's important to follow a healthy diet when you have diabetes. That doesn't mean that you need to avoid sugar altogether. You can have a healthy, balanced diet eating whole grains, fresh fruits and vegetables, lean meats, chicken, fish, and that's a very healthy way to eat and a very effective way to control your diabetes. Lower blood sugar definitely prevents the complications of diabetes, such as eye problems, kidney problems, and amputations. Anybody with diabetes is at risk for complications, and the better you control your diabetes, the lower that risk. People with diabetes should definitely exercise. There are some limitations. If your blood sugar is extremely high, that's a time when you shouldn't exercise, or if you have a foot ulcer or a complication of diabetes that may limit exercise. But in general, exercise is a very important part of the diabetes treatment program. One of the most important things for folks with diabetes is to know that this is a condition that you have a lot of control over, and that diabetes is exquisitely sensitive to diet, to nutrition, to exercise, and especially if you're overweight, losing weight is the best way that you can control your diabetes.
Controlling diabetes is key. 1 out of every 4 people living with it doesn't even know they have that disease. But for more information, log on to the American Diabetes Association's website at diabetes.org.